Hi guys, I'm Ashley and I am the founder of Oswald Digestive Clinic, and I'm so excited that you are here today because I have a very special guest on, Alexa. And the reason I invited Alexa is because it is National Infertility Week. And I think you're going to be blown away by Alexa's story and how she used functional nutrition to get pregnant, and now she has an adorable baby Willow, and I think you will just be inspired. And after she talks about her story, then we'll kind of dive into the whys of what she did and how it actually worked, from the science angle of things. So Alexa, can you start by telling us a bit about yourself?
Sure. So, as you said, my name's Alexa Kingery. I am actually from Bismarck, North Dakota. I'm pretty new to the Minneapolis metro. I'm a certified holistic health coach and an integrative nutritionist. I specialize in hormone health. I'm the founder of Balance and Bloom Nutrition. I obviously became interested in hormone health through my own experience with PCOS and infertility. So I suppose I'll just dive right into my story.
Yeah, tell us your story. And Alexa, so she's going to be starting to get her licensure in Minnesota soon here. So she's going to be opening her private practice after that. So if you're thinking through this, this is something I want to try. I've been struggling with infertility. Alexa, is it like 1 in 10 people struggle with this?
Yes, in the US, it's 1 in 10 people struggle with PCOS, and about 12% of women in the US struggle with infertility in general.
Wow, that blows me away. I did not know that until I started talking to Alexa. So this even makes me so much happier that we are talking and bringing this information to you guys. So yeah, why don't you tell us your story, Alexa?
Okay. Well, I was diagnosed with PCOS in high school a long time ago. And I remember the doctors always saying, you're increased risk for depression or heart disease or whatever. And then they would also talk about, you may have struggles getting pregnant in the future. So I always knew it would be hard, but I guess I just didn't realize how hard it would be. When my husband and I decided we were ready to try, I had to get off the pill. And I think almost half a year went by and I still hadn't gotten my period. So I got into a fertility specialist right away, and they induced my period with progesterone. And then they did some fertility testing and an HSG, which I don't know if people know what that is, but it's when they shoot dye up your fallopian tubes to clear them out and to see if there's any other issues
So is that
there.
a pretty standard starting care for somebody who's struggling with infertility?
I'm not sure because I have friends who have done fertility treatment in North Dakota, and that was not something they looked at until later on. I had lived in Arizona at the time, so the clinic there did that, and they did the HSG, they did the fertility testing, which is when it's a scale of 1 to 5. 5 is high, 1 is low. And I'll never forget when they did it, because she was like, I'm going to put a plaque with your name on the wall because I've never seen a number this high. My number was 52. So I was like, major outlier. And basically that was meaning I wasn't ovulating. So I was having anovulatory cycles.
Wow.
Yeah. So then after we did all of that, I think we did 4 rounds of IUIs, and they treated me with metformin, Clomid, HCG injections, which is what stimulates to release the egg, and then progesterone after the IUI, just in case I did get pregnant, to support the pregnancy and not miscarry.
Wow. And Alexa, for our viewers who don't know or are following, can you explain IUI?
Oh, intrauterine, oh gosh, I can't remember the other I. But it's basically they take your egg and then the sperm from the man, and they combine it for you, and then they inject it inside of you, just so, like, if you're just having intercourse, it kind of has to work their way up into your uterus, whereas when they inject it, it goes straight into your uterus, so your chances are higher of it being successful.
Okay, so 4 rounds of that, you guys. Okay, can you
Mhm.
tell us your story?
Yeah. So then after that point, they were like, this is normally the time when you'd move into IVF, which is when they actually fertilize it, you know, and inject it. And then we just didn't have the money and we were moving across the country and I was going back to school. And so we were just like, this is a good time to take a break from it. So a a year probably went by, still nothing. And we found a naturopathic doctor and she just helped me, work on some dietary changes, stress reduction techniques. She introduced acupuncture for me and we ended up treating myself with an antifungal for yeast overgrowth. And what was crazy to me is 6 weeks after I started treatment, I got pregnant. And my doctor actually told me that there was another patient with a similar story as mine, and the same thing happened. Literally 6 weeks after treatment, she got pregnant as well. So
Oh my
there's
gosh.
definitely, gut health and fertility definitely play a role.
Yeah. Oh my gosh. How many of you guys have goosebumps? Comment below if you have goosebumps. I mean, Alexa told me her story already, right? I just got goosebumps twice again. It's just wow. Wow, wow, wow. So remind us, Alexa, how many years were you trying before you started to see the naturopath and do that treatment?
Um, Well, so we did the 4 months of IUIs, and then, I mean, I didn't get pregnant until 3 years later. So another 2.5 years went by before I got pregnant. But I started working with the naturopath. I mean, like before I got treated with the antifungal, I was probably working with her for 6 months before that, making changes. So,
So it was acupuncture and nutrition and diet changes for 6 months, and
mhm.
then and stress reduction. And then it was 6 weeks after you started the antifungal for the yeast overgrowth.
Yep.
Wow. And so people, for you guys who don't know the yeast overgrowth, otherwise known as candida, that's when, our gut has this whole microbiota that's kind of these viruses, these bacteria, these fungi that are just in our gut. And most of them should be in our large intestine. And there shouldn't be as many in our small intestine because that's where most of the food should be getting pulled into the body, absorbed. So our gut lining, there is some permeability in our gut lining that's natural, like things should be moving in and out. But leaky gut intestinal permeability, that's when it's too permeable. And so because food's supposed to be moving in and out of the small intestine, there shouldn't be all this like fungus and bacteria up there. So when there is, that's kind of what we say and what Alexa is saying with the fungal overgrowth. And that's why she is putting on a medication to help to get rid of that in
Mhm.
her small intestine. But we want there to still be this kind of community of microbiome in our large intestine, just to connect some dots. And then the acupuncture, we're not going to be diving more into that in this conversation, but I just want to mention, and Alexa, let me know if you know anything more, but I have heard that acupuncture is one thing that can help with infertility as well.
Yeah, and actually, really cool. Another thing it can help with is induce labor. When I worked for the chiropractor, she had me do acupuncture a couple weeks before I was due, and it stimulated contractions, which is really cool. So,
That's
just another
very
acupuncture
cool.
note.
Yeah, if anybody's looking for an acupuncturist, we're not that, but we can connect you with somebody. We're dietitians, so or becoming a licensed nutritionist. So, is there anything more with your story, Alexa, that you want to keep sharing?
Um, no, that's pretty much it, I believe. Do you want to share more about gut health?
Yeah, I do. Can you tell us about some of the nutrition changes, the food changes that you made?
Sure. So the first things I did was I went gluten-free and dairy-free. And it was hard at first, but once you get used to it and you start focusing on like what you can have and not what you can't have, it gets a lot easier. And the first things I actually started noticing with positive changes, me doing that was I wasn't having seasonal allergies anymore and my asthma was going away. So I knew it was working. Inflammation was going down in my body. And then I had to reduce like sugar intake. And what else did I do? Those are definitely the big ones for diet.
And
Yeah.
so I want to add that is I have another story about the dairy free. My grandfather actually has been having a lot of breathing issues. He is age, 90s, maybe late 80s, but him going dairy free helps significantly with his breathing as well. So if any of our viewers are watching that, try cutting out the dairy and see how you feel, see if it makes a difference. The
Yeah.
gluten, that is very interesting to me because we don't have a lot of research on the connection between food sensitivities and infertility, but there is some suspicion for, ruling out celiac disease at least because of a potential connection there. And so outside of that celiac disease, we are learning more about this kind of gluten sensitivity that's not celiac disease in individuals. And some of these experts will talk about how celiac, it can really be a spectrum. The diagnosis is kind of that end stage death of the intestinal lining from all this inflammation. So it's the question of if somebody has a gluten sensitivity, might that be an early sign that they are at risk for getting celiac? And so that's kind of some of the discussions that are going on now with gut health. And I
Yeah.
think something really interesting to note, because as Alexa said, like it's hard at first, but if when you do it, you notice benefit. I've heard this from a lot of clients. It gets easier and it just gets worth it to
Mhm.
people. So I think that's something that we really should consider, especially
Yeah.
knowing that like food sensitivities can trigger this inflammatory cascade in the body too. And it makes me wonder if you were maybe having some because of that candida overgrowth as well.
Oh, totally. Yeah. And then also with dairy, not only, with breathing and stuff, but it's also really good for people with PCOS because a lot of them have the acne and the hair, the excess hair growth, and going dairy free can really help with that as well.
Oh,
So
do you think it's because of like those growth factors in the dairy or?
yeah, there's it's called IGF-1, and that is specifically known to really just mess with your hormones, and it can increase testosterone in your body.
Fascinating. So that's a definite connection there. And then the another thing with gut health that I think you guys might find interesting is that if our clients are having gut issues, almost all of them are malabsorbing nutrients. And so with that malabsorption of the food and the nutrients and maybe a lot of other factors that could be contributing to nutrient deficiencies, um, individuals struggling with infertility could be having some of these low nutrient stores or nutrient deficiencies that could be contributing to it being harder to get pregnant. So some of the nutrients that we have research showing is like vitamin C and vitamin D and vitamin E. And I'll pull up the chart here so that you guys can read and see, and you can pause this and screenshot this and learn more about how these micronutrients, so macronutrients, that's protein, fat, carb, but these micronutrients, these vitamins, these minerals, and how they can really play a role in the whole bigger picture in optimizing, making sure all the body processes are working properly.
Yeah.
So,
One thing, speaking of these nutrients that you pulled up on the chart, that's interesting is a lot of women, there's a correlation between women with PCOS and the MTHFR gene mutation, which is your ability to methylate and detox. And so some of these like folate and the B vitamins and magnesium are all really important to help with that as well.
oh, I'm so glad you brought that up. I actually personally have that too, and I've had
Mhm.
a
Do
vitamin. Oh, and I've had a vitamin B12 deficiency in my life, and
Yeah.
it was shocking because like I eat foods high in B12, but like I don't know. I'm curious to hear your experience, Alexa. But I was experiencing just like major fatigue to the point where I had to ask my employer to let me have Fridays off, like to not get
Yeah.
paid for a day, because I'm like I can only work 4 days a week. I'm like I can't do it. And so after replacing that B12, it just was life changing.
Mm-hmm. Yeah, same. The B complex I take is like literally life-saving. So it's very helpful. Yeah. And
Yeah.
it's good to know if you have it. So
Yeah, and just I am feel so strong about replacing micronutrients because I've seen it make a world of a difference in clients, from everything from like anxiety that went away because they were low on these nutrients that were contributing to anxiety, to like, the energy component and so much more.
mhm. Yeah, totally.
So, the last thing that I wanted to mention related to gut health, and we'll kind of dive into more of the hormone side of things, is that I don't know if you guys know, but we need fat to properly make hormones in the body. Our bodies need fat to make hormones. So that whole phase of, low fat, it really was not doing us a service. Certainly, there's still kind of the healthier fats, the fats that can contribute more um, to oxidative damage in the body, and we can make a whole nother video about that. But Alexa's gonna talk about hormones, and I'm gonna pull up a chart to show you how cholesterol is needed for this whole cascade of hormones. So, fat. And with gut health, a lot of times it goes back to that malabsorption piece. If our gut's not making these proper nutrients like the bile and like enough stomach acid to stimulate things downstream, then it can, or even like candida or like fungal or bacteria overgrowth, all that could be causing a fat malabsorption. And something to pay attention to is if you're noticing that your stool is overly odorous and floating a lot, or if there's some like oily substance on your toilet bowl, that is all a sign of fat malabsorption, something that we should kind of think about what the root cause to that might be. And then the last thing on it is we can actually even do stool testing to test the amount of fat in the stool. And when analyzing those results, we do want to think about like how much fat did you eat? Is it like a malabsorption, or is it maybe just like you were eating a lot of fat the day prior to your stool sample? But that can all give us some clues to help piece together that puzzle.
Awesome. Yes, absolutely. Okay. So two of the other big factors that play a role in PCOS and infertility, and especially played a role for me as well, are stress and blood sugar imbalances. Um, First, let's talk about stress. So our bodies have a fight or flight response, which is basically just our response to stress or like a sudden threat. I like to compare it to like if a bear is chasing us, but like our day and age, that's not really our problem anymore. Our stressors are our jobs, our relationships, the food we eat, and that can be stress from eating a high sugar diet, or it can be stress from eating foods we're sensitive to. Um, our household cleaning products and even the water we drink, all of these things can put stresses on our body. And what makes it even more complicated is stress can be real or perceived. And when I say perceived stress, it's like I can just think about having a fight with my husband and it can raise my cortisol, which is your hormone released from your adrenal glands in response to stress.
I'm
So
so
very
glad you
interesting.
I'm so glad you brought up the perceived stress. It's a very real thing. And again, you guys comment below if that's happened to you. Just say yes, perceived stress, because
Yeah,
yeah.
it just goes to show how easy it is to develop chronic stress or an issue with stress. And then obviously when you're chronically stressed, it can affect your other organ systems too. Like when you're stressed, your digestive system slows and you may feel more constipated, or your liver function slows and you're not detoxifying the way you should be. And then obviously the big one for me is when you're chronically stressed, your body prioritizes making cortisol over your sex hormones. So then you're not producing your progesterone, estrogen, and testosterone. So that's personally what happened to me. I remember I got my cortisol and my hormones tested with the Dutch complete test, and my cortisol was almost flatlined. My sex hormones were very low. I was almost at the level of a menopausal woman. So really managing my stress was a huge factor in getting my hormones back up. And then if you pull up the steroid chart,
And
you can
Alexa,
actually, oh, what?
can I ask you, are you willing to share what helped you the most as far as improving your chronic stress?
Um, I really had to start doing less intense workouts and focus a lot on yoga. There's actually a lot of studies on the benefits of yoga in women specifically with PCOS. So yoga, number one thing for me. I honestly, I hated it at first. It takes time. Like, I hear so many people talk about they tried yoga and they're like, I just sat in the whole class thinking, like, was I doing this right? Did I do that right? Like, and it's hard to really relax, but if you stick with it, it's just so helpful. And then just find, like, I really enjoy journaling. Not everyone does, but that helped me a lot. I have an app called Calm. I don't know if you've ever heard of that.
Yeah, I like that one.
Yeah, and I use that a lot. I'll just do like a 10-minute meditation daily, and that really helps a lot too. So,
Great. And tying in the yoga to the gut health, there's some good research showing that yoga to help with irritable bowel syndrome as well. Some research from, I
yeah,
think it was LA, California. And I think you're right, Alexa. And there's so many different types of yoga. So if you tried it once and didn't like it, try a different form, try a different type. And I'm usually surprised if there's not a type that somebody can like end up really
yeah,
enjoying.
totally agree. Okay, so the steroid chart. When we pull that up, you can see exactly how, if you're prioritizing cortisol, that you're not going to be producing your sex hormones, because pregnenolone can either take the pathway to go to DHEA and then onto your testosterone and your estrogens, or it'll go down to eventually create cortisol, which is often called the cortisol steal or the pregnenolone steal. But that's what happened for me.
And the cortisol, again, guys, that's stress. That's
Yep.
stress stealing from hormone production in the body.
Yep. And then I guess the other big factor for PCOS and infertility is your blood sugar or insulin. Um, so basically, your blood sugar, you want it to look as close to a flat line as possible throughout the day. And when we eat foods high in sugar, it often spikes that line really high. And that can cause a lot of issues. For one, high insulin leads to higher free testosterone in your body because of something called sex hormone binding globulin, or SHBG. You want your hormones to bind to SHBG, but when you have high insulin, it inhibits the SHBG. So there's more hormones basically circulating free in your body, which is the example of free testosterone. And then also important to note with that is oftentimes when women get tested and their testosterone shows up normal, it's because they're only looking at their total testosterone and not their free testosterone,
Mm.
if that makes sense.
Mm-hmm. So, how would our listeners ask their doctors to check the free testosterone, or what do you recommend, Alexa?
The Dutch test shows free, which is a good one to do. And that one's cool too because it looks at your cortisol at the same time as your estrogen, testosterone, and progesterone. That's my
Awesome.
recommendation for a test. So, and then lastly, to make matters worse with insulin, is your cortisol, your stress hormone, and your insulin, your blood sugar, play off of each other. So when you're really stressed, it can increase your insulin levels, or when you're eating a sugary diet and your insulin's really high, it can make your cortisol higher. So it's really important to, it just makes the low glycemic diet or low sugar diet even more important because it manages your stress as well.
Yeah, and it's all like we talk about in functional nutrition so much is just balancing all these pathways because they all really do work together as you just described.
Mm-hmm. Yeah.
And I think it'd be interesting for people to hear a little bit more about that fasting insulin because that's something that people aren't, I think, just in the conventional community, they're not used to hearing about because we hear about, their blood sugar is getting checked, their hemoglobin A1C is getting checked, which is, you can think of it as like the average blood sugars over the past 3 months. That's the hemoglobin A1C. But fasting insulin, that, Alexa, do you want to kind of explain what that is and how this plays a role with the PCOS and everything?
Um, how do I explain it? I guess it's just like there's your slow carbs and like your sugar. So sugar can be in fruit, but that's not all bad. And then it's in, your white rice and your flours and candy and a lot of your desserts, or pop soda is a big one. Those are the ones that spike your insulin and can just wreak havoc on your hormones. I believe slow carbs are important, especially gluten-free ones. That would be like quinoa, gluten-free oats, brown rice. The darker the grain, the better. Those really help manage your stress too, because the slower you can digest those foods, the better your insulin will be.
Yeah, and that insulin, it's kind of a more sensitive marker for kind of just seeing how the blood sugars are doing over the body. And like Alexa said, you don't want them going up, down, up, down. We want them to be a little more steady, like hills, not mountains.
Yep.
And so with doing those slower carbs, those like whole grains, and then combining them with like the protein, the fat, like we talked about the fat, that can really help to keep those hills going. And then the fasting insulin, if you've never had that checked, I would really, really recommend that you get that checked. And there are some labs that you can actually check it yourself. So, like direct labs, you can just send in for fasting insulin, have your blood drawn, have the results. It can be normal, abnormal, and connect that, send it to your doctor, send it to your dietitian so that you guys can talk about what to do about that. Because if it is elevated, don't stress. That's fine because that's one of those things that we can use nutrition and food and lifestyle to get down. So I'd rather now if it's elevated because there can be a pretty quick turnaround to getting that normal, even like days to weeks. When I was working at a functional medicine clinic out in California, we had a program called Help Your Diabetes, and we were helping people to actually reverse their type 2 diabetes. And within a few days of food and lifestyle changes, our doctors, MD doctors, were able to cut down insulin dosages of the clients that we were helping, which is just amazing.
Yeah, that's really cool. Awesome.
So thanks for explaining all that to us, Alexa. Is there anything else that we want to explain before we just kind of dive into the wrap up?
I think I think we're good. I did the insulin and the stress, which were two big factors in gut health for me with getting pregnant.
Yeah, that's huge. And PCOS, to connect the dots, one of the best things that you can do for PCOS is what Alexa described with the food and that insulin and that blood sugar.
Mm-hmm. Absolutely.
And so, some of our takeaways, we wanted to kind of focus on 3 categories for the takeaway, which is the stress, the low glycemic, the eating for those blood sugars, and then the gut health. And so, for gut health, I'll say that, then Alexa can kind of touch on the takeaways for the other two. But gut health, I wish that I had kind of one do this, your gut will get better sort of a thing. But for all of you who struggle with gut issues, which is actually 61% of people per a survey that was done in 2018 of like 71,000 Americans, 61% had a gut issue the week prior. And so if you're struggling, you probably know that it really needs to be personalized because there's so many different factors going on with the gut. And not everybody is going to have like the candida issue or, XYZ. So kind of getting a gut plan personalized that help you with your gut is going to be the best thing to do. And it's kind of the whole, again, that functional medicine, like think about the root causes, N of 1 study. So we all are our own study and we just want to optimize all the processes in the body, and then things downstream should align up.
Yeah. And I think the same actually goes with stress management and eating a low glycemic diet too. Like some things may work really well to help me reduce my stress, and it might not be another person's thing. I do really recommend everyone trying yoga, but again, I mean, it's different. Some examples could be meditation, whether that's just like deep breathing or practicing mindfulness or getting an app that can guide you through a meditation, journaling, gratitude, Epsom baths. And then I do like to talk about high intensity interval training too. It's really good to reduce stress, but it does actually depend on where you are with your cortisol. So if your cortisol is really high all the time, it can actually help. Whereas if your cortisol is almost flatlined, like mine was, and I wasn't producing my sex hormones, you want to really focus on yoga.
I'm really glad you mentioned that. I actually did a cortisol testing throughout the day myself once, and mine was kind of off the charts as well, but high, not flatlined. But I found that I had to kind of step back and do a lot more of the restorative
Yeah,
exercises versus like biking for 2 hours a day, which wasn't going to help.
right, right. Yeah, so it really depends. And then same with diet. Obviously, eating low glycemic is what you want, the whole grains, low sugar. Um, Gluten-free is often helpful, dairy-free is helpful, but really just finding any food triggers is helpful because that'll reduce your stress in your body as well. And then like you said earlier, the healthy fats, cholesterol is the building block of your sex hormones, so it's important to be consuming those.
Yeah, and we have another local functional dietitian that works in women's health, and she has seen a lot of cases where just improving the foods and balancing those hormones, like the blood sugars and the insulin, all that, has led to women being able to get pregnant too after struggling with infertility. So you
Yeah,
guys, this stuff, it seems like it wouldn't work. So it's like if it were that easy, why wouldn't everybody know? But it's so powerful, and the reason that not everybody knows is because, I mean, doctors are amazing, our healthcare system's so great if you get in a car accident, but the reality is most doctors have less than 20 hours of schooling in nutrition. So there's just a lot that you're not getting connected with in the
right.
conventional medical system. And that's why I started my practice, Oswald Digestive Clinic. And I think probably at least a component of why you're starting yours, right, Alexa?
Yeah, absolutely, 100% why I'm starting mine. Totally.
Yeah, and I'm so stoked that Alexa's in Minneapolis here. She's going to be doing telemedicine, but she's going to specialize in infertility, and she's going to help so many people. Like 12% of women are struggling with this, and I just
That's
cannot wait for her.
way more common than people think. So
So,
very exciting.
yeah, how can people connect with you, Alexa?
Um, so right now I'm on Instagram and Facebook, so follow along. And then hopefully I'll be starting to take clients in July. So very excited about that.
Cool. And if you're interested, just shoot Alexa a message on Facebook or Instagram, and you guys can get the conversation started. And as you saw on the screen, that's her Instagram handle. And then me, you can follow me at on the screen again, YouTube or Instagram are the best bets. And then I also have a free guide, 5 ways to improve your gut health. So if you want to learn a little bit more about this sort of a thing, you can go ahead and download that guide. So I think we'll just kind of wrap up now. Happy National Infertility Week, everybody. And if
Yeah,
you're a woman watching this and you're struggling and it's a really tough week for you, I hope this gave you a bit of hope to explore some things that you maybe haven't yet.
absolutely. So glad you added that.
Yes. All right. Until next time. Thanks again, Alexa. Thanks
Bye.
so much.
Thank you.
Bye.
Bye.